Thank you for listening to the Gateway to the Rockies podcast from Visit Aurora, from the rafters of the Stanley Marketplace. This is the show dedicated to telling the stories of Aurora, Colorado. Hi there, I'm Dave, Director of Marketing for Visit Aurora. Today, I'm thrilled to be joined by Dr. PJ Parmar, founder of Mango House, one of Aurora's most remarkable community institutions located in Aurora's vibrant cultural arts district. What began as a medical clinic serving refugee families has grown into an important hub for healthcare, social services, entrepreneurship, and some of the most beloved international cuisine in the region. Dr. Parmar, thank you for taking the time today. It's great to see you.
Thanks for having me.
Was there a spark as a child that led you to want to become a doctor? Was it, rooted in hey, this is a good path for me? Or was there an inherent desire even in your youth to help others?
To become a doctor, I actually didn't. I became an engineer.
Yeah.
And an environmental engineer, and I wasn't finding enough immediate ability to help people directly as I wanted. So then I switched it up. But yeah, there was an innate desire to want to make other people's lives better.
What was the root of that? Was it your observations going through life? Was it the values instilled with you? What can you credit that to?
I don't have an answer for that. I can tell you one story that I remember when I was about maybe 10 years old. My brother and I who was similar age, were at some sort of community Christmas event, and a bunch of wrapped presents were handed out, and all the kids opened their presents. And I just remember thinking I was rather indifferent to what was in my package. And there was another kid who really wanted what I got, and I just gave up what I wanted, which my brother saw as I had some valuable item, and he was quite taken aback by that. How could I just so readily give up something? But I remember to myself thinking at the time, like, it was more important to me to give this to somebody who really wanted it, because none of it made a difference to me. None of the material objects there mattered to me. And it seemed that it mattered to this other person, to made them happy. So let them have it.
It's interesting how a moment like that leaves an indelible mark of kind of who you become as a person. It feels like an innocuous event at the time, but you look back on it and you realize, okay, this is a defining memory. This is something that's going to lead to something bigger. What was the impetus that led you to creating Mango House? I know the story is well documented. There's a movie about it. It's fantastic. But what was the spark that began the project that is Mango House?
This was first my medical practice, which I started out a residency called Art House Family Medicine. And for a couple of years, that was just, I was renting in an office building, not in Aurora, actually in Denver on Leetsdale. And my lease came up, and the landlord there didn't renew my lease. He said somebody else needed the space who was a bigger renter. So I got kicked out.
No.
So I thought, let me get into the neighborhood where more of my patients were anyway. And let me do it in a way where I can bring together others who were of a like mind. I had previously lived with a whole bunch of roommates for many years in my own residence. And so it was a similar extension of that.
But before Mango House became the community hub that it is today, you were working directly with refugee patients, as you say. What were you seeing in your medical practice that convinced you that the healthcare I'm providing is valuable, but they need more?
Well, they would talk to me about community events and activities. Now, this was not stores at first. They were religious gatherings and need to meet here and about this topic or whatever. So I would try to make space in my medical office. Like, sure, come on over here. We can meet at this. I can give you a group a space to meet at this time. So it was obvious to me that people needed spaces to do things. So then I bought a building off of Galena and Colfax, 13,000 square foot building, and created Mango House, and had a handful of tenants, including notably Project Worthmore, which is in the area still. And they were working with refugees, still do, and a couple other small groups. But as I was there, we watched across the street, which is where I'm sitting now, former JCPenney, right, at Galena and Colfax, being turned over, basically. It had been a couple furniture stores, Sunshine and Broyhill, and then was bought by an investor who upgraded it a bit, did a few upgrades, including putting in the restaurants. and tried to make a run out of it. Briefly, he had a renter called Afric Mall, which had a catchy name, but that concept didn't take off long. But we were sitting across the street watching this for a couple of years, and I thought my patients were asking for more like, we need space for this and that, and I thought we could be doing this a lot bigger over there. So I bought the building across the street where I'm sitting now, tried to sell the first one, couldn't. So, or I couldn't at the time. So we're in both spots. That's been about 10 years now. That's total about 70,000 square feet on two sides of the street there with, as you may know, well, as some of the listeners may know, we do have 6 restaurants. Yeah. Many of the folks who come to the restaurants know only of our restaurants, but that's not our main event. It's healthcare. We have medical, dental, and pharmacy now. We've grown all of those, but those aren't necessarily even the most visible. The most visible may be that we have a couple dozen stores in addition to the restaurants. And then there's the invisible parts, which is a couple dozen religious gatherings and maybe a dozen community organizations that have offices. And I help create spaces for their activities in different ways. Spaces meaning like a madrasa, the kids may need to learn their Sunday school sort of stuff, or say GBCC, Global Bhutanese Community of Colorado, has a space. And then they rent a small office, but when they need larger community events or discussions, then I have larger spaces for them. So it's a lot of real estate space management.
It is a big space. When you initially found the building, which obviously by design you wanted to find in that neighborhood, which is the most concentrated population of immigrants or refugees in the state of Colorado, but there was, a serendipitous aspect to finding a space that ample. Did you immediately have that vision of this being even more than the medical clinic that you had initially envisioned for it because of the size of the space?
Yeah, well, when I moved into the first building, that was fully the point. Yeah. The medical clinic was 13,000 square foot building. The medical clinic was only about 3,000 of that. So I knew that's what I wanted, was to create. I knew that if you build it, they will come. You create spaces for like-minded people. So then based off of that notion, I knew there was potential to do a lot more, a lot of symbiotic stuff. Specifically when moving from that smaller building to this one, what I noticed in the smaller building was we had a lot of interest from the Aurora, from people from all over who saw what we were doing and wanted to be involved, meaning non-refugee, non-immigrant. I'm not going to say American because our immigrants and our refugees are American, but right. Non-refugees and non-immigrants, a lot of them from Stapleton area, because that's the closest, or Central Park, wanted to come help out in different ways. And some of them even hatched a couple plans, like they would ask for their school groups to come, and I would give a talk. But there wasn't much ways to get involved. They wanted to get involved, service hours and so forth, or at least a tour or a talk. There wasn't really. But I saw that in what we have here in the restaurant spaces, because we don't really have ways for folks to get involved in terms of volunteering and so forth. That's difficult. We don't do that very well, but they can come and eat the food and hang out, and their kids can play together, and they can play together. They can shop at the stores they want. The stores are not targeted at the non-refugee crowd, but they can come. The non-refugee crowd can come and shop at them and enjoy.
It's a beautiful mix of community resources, but also it's a business, and you're operating it as a business. Many people think of refugees primarily through the lens of resettlement, I guess, for lack of a better term. You've often focused on empowerment and opportunity. How does that kind of manifest in the overall philosophy that Mango House operates within?
Well, yeah, we're not nonprofit here. A lot of folks think we are and are surprised to learn otherwise. The medical, dental, pharmacy are not 501c3, and Mango House is not either. It's just a piece of real estate with a bunch of tenants. And the tenants, as of right now, I believe none are nonprofit. We've had a couple over time, but for the most part, they're not. They're small business America, individual, family-owned businesses putting in the hours to make it work. They sink or swim. So yeah, it's enabling them, empowering them. And what can I do to do that is make it real easy, a low barrier to entry, low barrier to exit, meaning your lease is as easy as possible. You don't got to sign on. It's all month to month. If you need repairs, we do the repairs for you. The restaurants, we fix up their appliances. They come in, they get all their appliances handed to them. And when they leave, it was month to month anyway. They just say, see you later. And in the middle, we're the ones coordinating. I'm the one coordinating the grease trap pumping, the hood vent cleaning. I have building cleaners, 2 of them. I have maintenance staff that, fixes all these things. So, and this is not my day job. My day job is coordinating 40 individuals through medical, dental, and pharmacy. So we create the real estate spaces for them, and then they do what they need to do, which brings in a community hub around it. The nice side effect is then those people come and are patients of mine then, if they weren't already.
You have a fantastic gift, and that is this perspective of all these different cultures, dealing with folks from countries all around the world, but understanding kind of the universal challenges and opportunities that arise for all peoples. What has that experience taught you specifically about, people starting over in a new country?
I am an immigrant. I'm not a refugee. People put the two together, or they'll say refugees and immigrants. A refugee is a type of immigrant.
Right.
My family is the other end. There's, in my observation, there's a very sharp divide in this country. You're either privileged immigrant or an unprivileged immigrant. The privileged ones, their families come in on like the brain drain H-1B visas, where their talent being taken from other countries. And the unprivileged ones are the refugees, asylees, and undocumented. So my family came as the privileged ones. Now, my family's of Punjabi, Indian background, but I was not born there. I was born in Canada, of all things, and mostly grew up in this country. But I did go through the process, get my green card, grow up in an immigrant household full of immigrant activity and so forth. And so I can understand where they're coming from, but I can speak the language here. What I mean is not just English. Having mostly grown up here, I know how to work the systems, maybe not as good as some people, but I can play the games. And so I can help. I see it as my role is to help the less privileged folks, the less privileged immigrants, to help navigate their way through the complexities of this society, whether that be mostly healthcare, which, believe me, takes a lot of navigating. That's primary care. That's our job, is to navigate the healthcare system. And especially in this country, when it comes to insurance or lack of insurance, specialty care, or where you need to go to get a certain body part taken care of and so forth, how to do it without the money in a lot of cases, but also then how to navigate, a business startup, like file for your LLC, your My Biz Colorado, your Aurora tax and business portal, your restaurant license, all these things. What are their considerations? And try to help talk them through these things, trying to help navigate society for them and create a bit of a buffer or a cushion to where they can fail, they can make mistakes and maybe not hit as hardly as if they went and tried to rent at any other office building or mall or restaurant, food court or community center, asking for space to have their church or whatever it may be, trying to provide a way for them to navigate all these things in ways that I can help.
Working in tourism and hospitality, obviously the International Food Court is a big part of what we promote, and it always comes up as one of the greatest assets of the city of Aurora. When you first conceptualized Mango House, did you realize that the food portion would be such a connective, powerful tool for economic opportunity and that cultural connection?
Yeah, when I was just across the street, we did not have the food court, of course. And yeah, that's when I saw that the non-refugee people were wanting to interface with the refugee people. And I didn't want it to just be in a classic, how do you say, museum type of way. I mean, because that becomes zoo-like, like where people come and are observers of as outsiders. I wanted it to be more of a living museum, which is what it is. So they can come and hang out among different cultures that they would not otherwise. People come in, sure, from nearby, from Aurora, but some from very far. to come here. Some fly in. We hear a lot of people on their way to and from the airport stop here because they hear about it and they want to experience wherever they're from, whether it's urban or rural. They're not hanging out necessarily with among Oromo people or a Rohingya grocery where they're playing Karom all the time, or a Somali store that has a Somali tailor outside, or a Nepali tailor, or a Syrian tailor, or Mauritanian tailor, or any of the other aspects that they just are able to watch go by them here. And these are things going on are not put there as a show for them. It's the real life of these folks.
Restaurants like Jasmine Syrian Food, others have gained devoted followings, as you've just alluded to. Are there personal success stories from some of the entrepreneurs that particularly stand out to you or that you're particularly proud of?
Sure. We've had a lot of businesses come. We've had some go. And the successful ones, it's great to hear them. Yeah, Jasmine Syrian is a great success story. Urban Burma, our Ethiopian restaurant, those three have been here the longest. Urban Burma has quite a following. For a while, it was the only Burmese food between Chicago and LA. And there are people who come in for these restaurants. Oh, most recently, our Haiti restaurant, 509 Cuisine, 509 being their area code in Haiti. She gets people who come in just for her restaurant, Haitians. What I mean is, I see them in the parking lot holding their phone out, like trying to figure out how to get to her restaurant. They don't know anything else, that there's 5 other restaurants here, or medical, dental, pharmacy, or anything else. That means these restaurateurs are, those ones I named anyway, are making a success for themselves in their own right, that they would have been making anywhere else. Except it's wonderful to have it here because it brings together this, I'm not sure there's other places you can find this in the country or world. I've traveled the world quite a bit myself, the majority of it, a few times. And you can get food courts and you can get occasional interesting restaurants, but I don't know how often you can get a food court of these unique restaurants we have here.
And you're also providing healthcare services. You're running a medical clinic, which is already a full-time job. How do you stay motivated to build and support such a large ecosystem of services and businesses and what is essentially a cultural center?
Well, I got a lot of great staff.
Nice.
I just got a lot of great staff. I've been lucky, or whatever it is, that over time there's certain key people that have come in, and I do what I can to help them stay. And I'm able to delegate, keep things going. I keep a lot of delegation to-do lists. Everybody's got their tasks.
It's such an interesting dynamic because it is community resources for very specific people, but it's also a public-facing, open, market and food court for the visitors that are coming into Mango House for the first time. What do you hope they take away from the experience beyond simply enjoying a great meal?
I know that many of them don't interface with these cultures or even sit in a room with these cultures. The closest many folks would come to these cultures would be if they happen to be somewhere like, say, the Aurora Mall, and a family of a certain background walks by them. They might watch that family for a second walk by. But here they can watch it for long periods of time. Tons of the families running around here, the kids screaming, everything. So, there's the question of, is anybody learning something? I think some people find it enjoyable, refreshing. Some people find it a form of travel if they can't afford to go somewhere else, or a simple escape from their daily routine. As food can be, you go out to a nice restaurant. So this is part of that atmosphere. But some people find it a little bit mind-opening. They when you get exposed to some new things. Some might bring a friend. And, that's where it gets, that to me, potentially wonderful. If the friend has not been exposed to different cultures, maybe it opens their eyes in a positive manner, hopefully.
Mango House, being as unique as it is, has attracted national attention, documentaries, media coverage, academic discussions. Has the global and national attention of Mango House kind of changed the way that you think about the project's role, both locally and nationally?
No, it hasn't. I get a lot of questions of could this be done in another city? Or have you heard anybody doing this? And the shortest answer is, I don't know, and I've never heard any. We're not here trying to be a model of anything. If people want to take away bits and pieces, they can. But, there's some parts here that, to be honest, we run a very efficient medical clinic that makes money, and then that helps underwrite the costs of the space, which allows us to provide sub-market rents and help the communities. And putting all these pieces together ends up in a very unique fashion, especially not as a nonprofit. So I think others may view it as a novelty, which is great. Hopefully some view it as a means of expanding their horizons, their thinking, and or a service mindset. Like, even though we're not a nonprofit, that's definitely the goal here. This is social entrepreneurship. It's service to others. And so some may say, there are people in my community that I could help.
How have you approached keeping Mango House a safe space for immigrants and refugees in a time where, the political atmosphere is frankly hostile?
We don't, there's a lot of things we do here that are not publicized. For example, you may notice our website is almost nothing. Mm-hmm. That's very intentional.
What challenges are refugee communities facing today that concern you the most? And how can local residents and visitors become better allies and neighbors?
Well, the biggest challenge about to happen is Medicaid is going to be lost, and some other social service benefits. To some extent, what's called food stamps, SNAP, the welfare programs, the TANF, mostly the healthcare, the Medicaid. So folks who have had it for years are going to lose it. What can anybody do about that? Probably not much unless they're in the medical field and they work in a specialty office or a pharmacy or radiology. They can re-examine their approach to taking uninsured folks. There's a lot of clinics and entities out there that price stuff way too high or too complicated for anybody to navigate. I'm sure you or other listeners know you interface with the medical system, you never have any idea how much you're going to pay, and it's usually way too much for any part of it. But being transparent about that can help the ton of people who are about to hit being uninsured, which is happening starting in the next couple months here.
There seems to be a growing sentiment. Communities are feeling like, okay, we need to pull together and help each other out. And Mango House almost serves as, you're not aiming to serve as an example of that necessarily, but that's what you're doing, whether it's intentional or not. What gives you hope, in light of the current environment? What do you see that says, okay, we have some light at the end of this?
Everything gets better with time. And you, me, we all have had some rough periods in life, and time heals all. And in this case, give a couple of years, these things come and go. When I was started practice 15 years ago, which is not 50 years, but 15 is enough to have seen, the rate of people in Medicaid, in social service benefits at that time, was about what it's going to become later this year. What I mean is it went up from there. So that's been enjoyable. With there was Obamacare, Medicaid expansion, some COVID expansion, different policy aspects that helped things go up. It used to be a program just for women and children, and maybe even just pregnant women. Adult men could not get Medicaid. And then, we had that. Then we had it on dental benefits, and then dental benefits with no limit. Now it's getting cranked back a bit, $3,000 cap and so forth. These things come and go, and we've been here that whole time, and our numbers are just fine. We'll remain here. And if this is the worst it gets, bring it on. Give us a couple of years, and it'll get better.
I love that. This podcast is called The Gateway to the Rockies, and we love highlighting the people who make Aurora special. If a friend were visiting Aurora for the first time, obviously you're taking them to Mango House to have a great meal and do some shopping and experience everything that's there. Not that you can play favorites, but what are you encouraging them to try? And where else would you possibly take them around the city?
What would they try here? Well, they're probably going to hit up our restaurants. I would say get a little piece of something from each of the restaurants. Where else around the city? Well, I'm a bit partial to this part of the city because this is where I am. I just think it's got the character. It's the oldest part of Aurora, right? Original Aurora, they call it. And I believe we have the least number of chain businesses here. In fact, the chains didn't quite make it. Just within one block of me, out of business are Family Dollar, Dollar Tree, Walmart, and Walgreens, all within one block of here.
Yeah.
So the chains don't make it here. You want to see something unique? Come here, try. You don't have to come to Mango House. Go to any of the businesses down the street here, and you're going to find, our African-American barber shops or braiding shops, the Mexican tire store across the street. You just got to open your eyes and step into these places, and there's phenomenal cross-sections of America at every opportunity, which are not the chain places.
I'm going to be a contrarian and say everybody absolutely needs to go to Mango House. We had a team lunch there a couple days ago and just was blown away, not only by the food, but the hospitality, the environment, the people. Dr. Parmar, what you've given the community is incredible, and I'm so lucky to be able to help promote it, and we wish you the best as you go along in your mission.
Thank you.
That was Dr. PJ Parmar, founder and owner of Mango House. If you want to experience the spirit of a global community, a real authentic experience, and have some of the best food you'll ever have anywhere, visit them at 10180 East Colfax in Aurora. That's right, at Colfax and Galena. Visit Aurora is the official destination marketing organization for the city of Aurora, Colorado, and acts as the primary liaison between meeting planners and hotel partners. As Aurora's Convention and Visitors Bureau, Visit Aurora's mission is grounded in showcasing Aurora as a premier destination for meetings, business, and leisure travel. Visit Aurora represents more than 60 hotel properties with 11,500 guest rooms and more than 1 million square feet of meeting space, including Colorado's largest and newest resort, Gaylord Rockies Resort and Convention Center. As Colorado's third largest city, Aurora is located minutes away from Denver International Airport and showcases mountain views, memorable meeting spaces, and 400 plus international eateries that offer a unique experience for each and every visitor. As the gateway to the Rockies, Visit Aurora's role in the community goes beyond marketing the city as a destination. The Visit Aurora team is here to assist you with your Colorado visit, from facilitating your meeting, event, or convention to helping you discover local flavor and attractions. Go beyond the boardroom in Aurora. For more, visit us at visitaurora.com.